Question number 1. Why is COVID-19 killing the adult but not children? Researchers at the Chinese Center for Diseases Control and Prevention in Beijing looked at more than 72,000 confirmed cases from China as a part of a recent analysis and found that children at the age of 10 accounted for less than 1% of all infections. More than 1,000 deaths recorded in China at the time, none include children. The WHO has reported that 2.4% of reported cases were children under the age of 19 and just 0.2% of cases were children who become critically ill. We see relatively few cases among children. WHO Director General told reporters in February more research is needed to understand why. Question number 2. Will weather affect the virus? US President Donald Trump has repeatedly claimed warm weather will minimize the spread of coronavirus, but experts say it's too soon to tell. Now the virus we are talking about, a lot of people think that goes away in April with the heat, Trump said last month. Also said there are essentially two ways of getting the virus: direct contact with the infected person or touching a contaminated surface and then touching your face. Someone can cough on you in any weather, but for common touch surfaces and contaminated surfaces, weather matter bigger time. He said, in hot weather, viruses fold up and die. Coronaviruses are called enveloped viruses, meaning the virus has an outer wrapping. How fragile that envelope is to heat will be tested in the coming months. Donald Trump is assuming the virus will behave just like a flu. Question number 3. When will a vaccine be ready? There are no drugs or vaccines currently approved specifically for COVID-19, and it's too unclear when they will be ready. There are 2 clinical trials in China and 1 in US evaluating antiviral drug from Gilead Scientists Inc. that was also tested for Ebola, according to the Wall Street Journal. Meanwhile, in the US, a health research institute in Seattle is preparing to test 45 volunteers with different doses of shot call developed by NIH and Modern Inc. Doctors at a hospital in Wuhan are also conducting clinical trials using combination of 2 drugs from HIV that have been tested on a patient in Saudi Arabia. Question number 4. What is the case fatality rate? The WHO has said the death rate from known cases is about 3.4%, significantly higher than the seasonal flu, which is about 0.1% according to the CDC. The WHO calculation is based on the number of reported cases and deaths. Some health officials have said 3.4% mortality rate could be much lower, as about 70 to 90% of people who get COVID-19 already display mild symptoms or asymptomatic and may never be counted among the reported cases. Question number 5. How long can it survive on surfaces? The WHO says it's still unclear how long the virus can live on surfaces like metal hand rail, a water glass at a restaurant, or a plastic credit card. On review of 22 studies found that coronaviruses can last on surfaces such as metal, glass, or plastic from 2 hours up to 9 days. Warmer temperatures reduce how long the virus can survive according to the review. Public health agencies are advising people wipe down common touch surfaces like countertop and doorknob with household disinfectant wipes and cleaners. Officials have also repeatedly said hand washing for more than 20 seconds with soap and warm water is the best way to prevent the spread of the illness. The last question, question number 6, is how the virus jumped to humans. COVID-19 likely come original from bats before transferring through an intermediate host to humans, according to the WHO and researchers. It is not clear exactly how the virus made to jump to humans. One theory is that the in-between animal may have been a pangolin, one of the most illegal trafficked mammals in the world, which is solely a wildlife market for its meat, and they are scarcely used in traditional medicine. However, this idea was later cancelled by scientists in China.